Well, Mr. Secretary, HHS is delaying billions in funding for Head Start and child care. These funding delays meant that a Head Start program in my state that serves more than 400 children had to close its doors and left parents scrambling. So let me ask you about another child care issue. Secretary Kennedy, whose decision was it to withhold child care and development block grant funding?
Senator, I want to point out that in 2021, at the beginning of his administration, President Biden submitted his budget on May. You know what? You made an accusation to me, and I'm going to answer it.
Okay, I appreciate
on May 28th, he submitted his budget. So our budget. We're a new administration.
Okay, you can.
And I also want to point out.
I have just 2 minutes left. I asked you a specific.
I want to point out something, Senator. You presided here, I think, for 32 years. You presided over the destruction of the health of the American people.
Well,
our people are now the sickest people in the world.
Seriously,
because you have not done your job.
Seriously. That is an
what have you done about it? What have you done about the epidemic of chronic disease?
Mr. Secretary,
what have you done about the epidemic of chronic disease?
Seriously, Madam
Secretary,
Chairman.
I would ask you to hold back and let the senator ask the questions.
Mr. Secretary, I'm asking you a question about child care. I'm asking you who made the decision to withhold child care and development block grant funding.
That was made by my department.
Okay, and you said last week, quote, we were not cutting thousands of scientists, we are not cutting clinical trials, but I want you to know in the last 4 months, you fired or pushed out nearly 5,000 NIH staff and terminated more than 1,600 NIH grants. That includes more than 240 clinical trials across the country. So whose decision was it to fire scientists and terminate these NIH grants and the clinical trials?
Senator, I don't trust your information with all due respect. You told me 3 days ago or 4 days ago that we had cut a clinical trial in your state, and what you said turned out to be completely untrue, and you knew it was untrue because you corresponded with Jay Bhattacharya before that.
Madam Chairman, I will answer that. It shouldn't take me, first of all, raising an issue with you face to make sure NIH is working its way through this. The woman that was in question, as I clarified to you at the last committee, was qualified for a clinical trial, unlike you stated. So
untrue. Untrue.
No, that is true.
Untrue. She qualified this week. We shouldn't be talking about patients' private information.
I agree.
Anyway.
And let's leave that. And I will just say your staff didn't get back to me till 45 minutes ago.
We have the emails. We have the emails from your staff 2 weeks ago. 2 weeks ago, you were corresponding. What you said you knew was untrue when you said it to me.
You came here to argue with me. I came here to ask you questions about your budget request. Your budget request is asking us to cut dramatically, but I am also making the point that Senator Baldwin made, that what you are doing right now is enacting your budget that Congress has not passed by cutting critical funding across the board. And I think this committee will find that to be very detrimental in the future. Thank you, Madam Chair.
Mr. Secretary, how many employees were there at HHS when you took over?
82,000.
How many do you have today?
62,000.
Okay.
It's about the level it was in 2019, right before COVID.
Is this the first time that an institution in America has ever downsized?
I don't think so. I think private and public institutions have
Microsoft just announced that they were going to reduce their workforce by 6,000 people. You think that'll be the end of Microsoft?
Senator, we wouldn't have reduced anybody.
You think that'll be the end of Microsoft?
I don't think so, Senator.
Meta, I still call them Facebook, just announced they're going to reduce their workforce by 3,000 people. You think that'll be the end of Meta?
I imagine it will not.
Yeah. Think maybe the people at Meta know what they're doing?
I think that they do. They make a lot of money, Senator.
Do you hate NIH?
I love NIH. I grew up with NIH. I visited when I was a boy. I loved science, and those were my favorite afternoons, visiting the labs.
Do you hate medical research?
No, I think we need to lead the world in medical research in this country.
In fact, isn't it true, Mr. Secretary, that you would like to see more money spent on medical research?
Obviously, I'm the secretary of this department. No secretary wants to see his budget cut.
Well, one way of doing that, it seems to me, would be to stop some of the stealing. And let me tell you what I mean by that. Let's suppose you give NIH gives a university $100 million to research, for medical research, to research a cure. And that university takes $30 million of it, doesn't spend it on the research. They use it to subsidize the rest of their university. Does that show a commitment to medical research?
No, and I mentioned before the example of Stanford, which was taking 78% in indirect costs, and we don't know what they were spending.
That's theft, isn't it?
It's not a good
in
way to
Louisiana,
spend
we call
federal
that stealing.
taxpayer dollars.
We call that stealing. Is there any doubt in your mind that a lot of universities are taking this NIH money, which is supposed to be spent on medical research, and using it to fund other parts of their university? Is there any doubt in your mind, Bobby?
Oh, and Senator, the other people who are writing grants, like the Gates Foundation, the Rockefeller Foundation, they pay 10% to 15% in indirect costs. We were paying 50, 60, 70%.
So, in fact, what you're doing is adding money to medical research.
We will be able to fund many, many, many more studies by eliminating that $9 billion, at least part of that $9 billion cost.
Okay. I want to ask you about LAHEAP. Are you familiar with this GAO report they did on LAHEAP? LAHEAP?
I am not, Senator.
They found, they audited 7 states. They found 11,000 dead people getting LAHEAP grants. You familiar with that?
No, but that is pretty typical of many of the other programs that we're working with.
They found prisoners getting grants, didn't they? Were they using the grants to heat their jail cell? They found 1,000 federal employees getting the grants with federal salaries that greatly exceeded the income limits. They found some of those folks living in $1 million homes. I got 18 seconds. Why do we allow highly processed foods in America?
That's a complicated question, but it's driven by profits, but to a food industry that is making money by poisoning American kids, and they don't do it abroad. They make the same products for Canada and for Europe that do not contain many of those chemicals.
You understand, Mr. Secretary, there's nothing you can do that's going to make many of my Democratic colleagues happy. You get that, don't you?
I do understand. I'm coming to understand that, Senator.
Yes. Thank you.
Thank you for being here, Mr. Secretary. Let me ask you a startup question. Do you know the #1 cause of preventable death in America today?
The #1 cause? Well, I know what the #1 cause of deaths is in this country. I'm not sure what you're talking about.
I'm talking about tobacco. You fired the head of the CDC's Office of Smoking and Health and eliminated their efforts from your budget. Hundreds of employees at FDA's Tobacco Center, including the director, have been let go. If we are genuinely concerned, and I believe you are, about the health of America and making it better, something as basic as the #1 preventable cause of death is not served by that kind of dismissal. Let me take you to another issue that I think is personal to me in a way. It reflects a tragic situation involving ALS. A friend of mine named Brian Wallach used to work in the Obama White House. And Brian met his wife-to-be, Sandra Abravaya, who was my press secretary. They married. When their second daughter was born, Sandra came home from the hospital to learn that her husband had ALS. Brian and Sandra have been fighting a battle now for 8 years. He's still alive. He can no longer walk or talk, but he has hope. He loves his family, and he's hoping that something will break through in ALS that gives him a chance for a future. Please explain to Brian and Sandra and their 2 young daughters why you've canceled ALS grants at institutions across this country and why you think research for diseases like ALS should be cut by 40% next year.
Senator, I don't know about those cuts. I will have to, I don't know if that's true. I don't know if those were part of the rifts, in which case the people were not fired, but they were put on administrative leave. The issues that you're talking about are issues that are important to me: tobacco, ALS, and I know you have a passion for congenital heart disease as well. Those are all issues that I'm deeply concerned with, and I'm happy to meet with you at any time and talk about the programs and what we can do to make them better.
Of course, you're welcome, and I think the conversation is important. But I want to remind you, on April 1st, 10 laboratory heads at National Institute of Neurological Disorders and Strokes received their layoff notices. They were all PhDs and senior investigators. They're not administrators, whatever that might be. They were running intramural labs at NIH. If you have your way, they'll all be gone on June 2nd. Science Magazine reported 25 of 320 physician researchers at NIH's Internal Clinical Center are leaving, and the number of patients treated in the hospital has been reduced by 30%. 3 grants involving ALS and dementia work at Northwestern University in Illinois have been paused. One looking at how to stop the buildup of damaged proteins, another looking at cellular mechanisms that can be drug targets. Just last week, an ALS researcher at Harvard had his grant cut that was using AI to accelerate the reversal of ALS symptoms. Brian Wallach is waiting for a cure. He is not giving up. His source of hope is this research that you unfortunately are terminating. How can we possibly address his concerns and give hope to people across the country who are suffering for so many diseases when our government is cutting back on that research?
As I said, Senator, I do not know about any cuts to ALS research, and I'm happy to meet with you.
I just read them to you.
Yeah, I will have to go and talk with Jay Bhattacharya and find out what the rationale was for those cuts. I just don't know about them until you told me about them at this moment.
There are many things that concern both of us about the state of public health in America. And questions you've raised, I think, are legitimate questions, many of them, that I want to follow through. I want to know the honest scientific answer to these questions. And I want to make this point. Cutting medical research is giving up on the future. You can't do that. These families are counting on you, Secretary, and counting on your department to do this research. It gives them hope to live another day. Turning out the lights and saying you're doing it in the name of efficiency or DOGE or whatever it is no consolation to these families that are struggling. Thank you, Madam Chair.